Hello and welcome to Good Life, the health show with me, Puja. Well, viewers, self-monitoring during COVID means people should monitor themselves for fever by taking their temperatures twice a day and remain alert for cough or difficulty in breathing. If they feel a feverish or develop measured fever, cough or difficulty in breathing during the self-monitoring period, they should immediately self-isolate, limit contact with others and seek advice over phone to determine whether medical attention is needed or not. So to discuss on this, we are being joined by Dr. Hrishikesh Bora, MD consultant from Downtown Hospital. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Thank you so much, Dr. Hrishikesh Bora, for coming to Good Life, the health show. So in the entire episode, we are going to talk on self-monitoring for the patients who are in home isolation. So this is indeed a lot of questions surface in this regard as is self-isolation. So first off, I would like to ask you, is self-isolation recommended for the patients who have been detected with COVID-19? What is your take on this?
Yeah, self-isolation is actually a controversial topic because we have seen in recent times during this current outbreak, if you like, lots of patients who are on self-isolation, they present late to the healthcare centers and with very serious symptoms. So we should be very vigilant and monitor those patients who are on home isolation so that we don't end up with that kind of thing. So regarding your question, whether patients should be advised for self-isolation, yes, a segment of patient can opt for home isolation. The patients who are asymptomatic, who are otherwise healthy, do not have comorbidities, and people who are less than 50 years of age. So this subset of people, they can opt for home isolation, provided they have the adequate setup for the home isolation at home. Means you have a separate room with a separate washroom, and you have a care provider at home who can contact you, and also you need to have communication with your healthcare provider, so that you can communicate if there is any danger signs that arise during your home isolation period.
All right. So, doctor, if we talk about the general care of patients at home isolation, so what would be that? What should the person should know about the general care that has to be taken by him or her or by their fellow members?
Yeah, general care means the people who are advised for home isolation are generally asymptomatic or they are having very mild disease. So the general care is like they have to be in a separate room, then means isolated, and they have to take the normal diet. They can have a very nutritious diet, have lots of fluids, and main thing is you have to monitor your own symptoms. You have to monitor your pulse, your BP, not necessarily BP, the SpO2. You should have a pulse oximeter with you, and also monitor your pulse, which is shown in the oximeter, and also your symptoms, like if there is worsening of cough, if there is any difficulty in breathing, shortness of breath, then immediately you should approach your healthcare provider.
All right, so self-monitoring by oximeter, which is also a talk of the town, and everybody is being provided by either by the government or now person are very much cautious, so they keep this oximeter at home. So do you advise everybody now to have an oximeter with them, because this is the need of the hour and one has to keep it with them so that to see that their saturation of oxygen can be checked time and again?
Yes, the patients who have been detected as COVID, or there are some people who have symptoms of COVID but they have not tested themselves for some reason or another. They should also monitor their SpO2 at home. So you need to have an oximeter for that. But thing is that with oximeter, sometimes people get very nervous because they don't know about that reading and all. But that because you have to put it in a proper way.
Okay.
The oximeter has to be put in either index finger or middle finger, and then there shouldn't be any nail polish or something, so that may give a false reading. So people, they panic if you have a false reading. And also another thing, that the pulse rate is shown in the oximeter, but sometimes what happens if you climb up a flight of stairs, your pulse rate will go high in any case. Okay. So that sometimes we get calls from people, see, I'm having a pulse rate of 120, what will happen, will I die, or that kind of thing. So there's nothing to be worried about that, but you should take it while you're at rest, that pulse rate.
All right. If we talk about the
So
period,
that's
the
all
period
people
of
should
time
have.
to be in home isolation, so usually 14 days have been given, or maybe maximum to maximum if person wish to stay some more time for the benefit of their parents or the fellow members. So how long should a COVID-19 patient be under home isolation? What is the medical team or the medical experts saying on this?
The official period is, like you said, it's 2 weeks, that's 14 days. But thing is that when suppose a patient is asymptomatic, he generally, after 10 day, the infectivity rate goes down. After first week also it goes down in asymptomatic patients. Suppose on day 10, the patient doesn't have any fever, history of fever for last 3 days, he doesn't have any shortness of breath or any other symptoms. So that kind of patients, they can hardly transmit any the disease to anybody else. So that is safer, but it's better to adhere to that 14-day rule, because the risk of transmission is there, although it is less.
So 14 days, and they can also seek advice from the medical experts over phone, which nowadays is very much in, and people do that because they fear to go to hospitals, and the ones who are asymptomatic and the ones who are the members, the family members of the COVID-19 patient, so they can seek that advice over phone with the medical experts. That facility has been opened by the hospitals, isn't it?
Yeah, that is very essential actually. That the patients who are on home isolation, they should have some contact with your healthcare provider. Your doctor should know about your symptoms, what is happening. Because unless the doctor knows, some people, they tend to ignore symptoms. Suppose a patient is feeling very weak, he is hardly able to get up from his bed. That patient needs immediate medical attention. He cannot continue with home isolation. So that has to be conveyed to the doctor. So that SpO2, now everybody knows if it is less than 94, then you have to seek medical attention. So generally what happens in the first week, we hardly get that kind of things. The complications of COVID, the danger period, if you like, that is mostly between day 5 and day 10. So we see a lot of patients deteriorating during that period. So you have to be extra vigilant, because once the fever goes off, there is a tendency to take it lightly. Okay, I have been cured, like that. So
okay, doctor will come to that day 5 and day 10. What exactly happens, as you said, that is very important. We have a caller waiting. Let's take the call first, and then we'll proceed with the conversation. Hello. Hello.
Hello. Hi, my
yeah.
বাইদেউ এই পোস্ট কোভিড নোহোৱাৰ কাৰণে কি কি সাৱধানতা হেৰি কৰিব লাগে, লক্ষণবোৰ আৰু কেনেকুৱা হ'ব?
মানে কোভিড নহবৰ কাৰণে
পোস্ট কোভিড কমপ্লিকেশনস,
না অলৰেডি আমাৰ কোভিড হৈ গ'ল এবাৰ, তাৰমানে পোস্ট কোভিড নোহোৱাৰ কাৰণে আমি কি কৰিব লাগিব তাৰ পৰা বাচি থাকিবৰ কাৰণে?
পোস্ট কোভিড নহবৰ কাৰণে মানে পোস্ট কোভিড সিচুৱেশ্যনটো আফটাৰ কোভিড আপোনাৰ মানে বহুতখিনি বেলেগ কমপ্লিকেশ্যন আহিব পাৰে. এতিয়া আমি দেখি আছোঁ হাৰ্টৰ কমপ্লিকেশ্যন কিছুমান আহে, ব্ৰেইনৰ আহে, লাংছৰটো আহে. চ' মানে কোভিডটো হৈ যোৱাৰ পিছত আপোনাৰ এটা চেকআপ এটা লাগে, যোন মানে চব পেচেণ্টৰ নহয়, এইটো বেছিভাগ পেচেণ্টৰ নহয়, পূৰা ভালেই হৈ যায়. কিন্তু কিছুমান পেচেণ্টৰ ৰেচিডুৱেল কিছুমান হেৰি থাকে, মানে লাংছৰ কিছুমান ফাইব্ৰচিছ হয় বা হাৰ্টৰ কিছুমান ইছ্যু আহে. চ' সেইবিলাক বস্তু নহ'বৰ কাৰণে আমি একচুৱেলি কিছুমান টেষ্ট কৰিব লাগে. চ' এতিয়া সেনেকৈ টেষ্টটো আপোনাক ডাইৰেক্টলি এডভাইচ কৰাতকৈ মানে বেটাৰ হয় যে মানে ডক্টৰৰ লগত কনচাল্ট কৰি পেলাই সেই টেষ্টখিনি কৰাই লৈ যাতে প্ৰব্লেম নহয়. আৰু মেডিকেশ্যনছো আছে এনেকুৱা, মানে ক'ভিডটো হোৱাৰ পিছত যেনেকৈ ক'ভিড ষ্টাৰ্টিঙত আমি ভিটামিনছ দিওঁ, হেৰি দিওঁ, তাৰ পিছৰখিনিত কিছুমান মেডিচিন কণ্টিনিউ কৰিব লাগে. স্পেচিয়েলি মানে যিখিনি মানে অলপ মডাৰেট ডিজিজ হৈছে, একদম মাইল্ড ডিজিজত নালাগে, মডাৰেট ডিজিজত কিছুমান মেডিচিন আমি দিব লাগে টু মানে প্ৰিভেণ্ট কাৰ্ডিয়েক বা সেনেকুৱা বেলেগ কিবা কমপ্লিকেশ্যনছ.
All right, thank you so much for calling at this moment. Doctor, you were talking about the ones who are in home isolation. So day 5 to day 10, what is the difference and what is the thing that one has to be taken care of on these days?
Yeah, day 5 to day 10, actually what we suggest now is, because it's very difficult to predict who is going to go into a moderate or severe disease and who is going to pass it off as a mild disease. So what we advise is on day 5, we advise a certain few investigations, blood investigations, to see whether the inflammatory cascade is on an overdrive, like we do that ESR, CRP, and also D-dimer. So that those things can predict that patient may go into severe disease or not. So for that, depending on the patient's condition and their reports, we sometimes need to use steroids. But thing is that steroids are being overused and misused. People with mild disease, they are using steroids. That is not advisable. So do not self-medicate. Do not use steroids like that. So we better consult your healthcare worker after 5 days of your symptoms, so that he can assess. And some patients need steroids, some they don't. So that is what. And then the day 5 to day 10, that is the period when the fever subsides. But some patients, they go into hypoxia, means they start developing low SpO2, and those patients need immediate hospitalization and further treatment.
Okay, okay. Now, doctor, if we talk about that, who should go for home isolation and who should not, because now the government has also fixed that above 50 years of age, they won't recommend for home isolation. And talking about the young people also, if their oxygen level is not appropriate, they will also be not allowed, they will not be suggested to go for home isolation. So, according to you, what would you like to suggest the viewers who should go for home isolation and who should not, and what things they should keep in mind before doing that?
Yeah, the government has rightly pointed out that the home isolation is not advisable for the senior citizens, but for the younger patients, we have to keep in mind that the people who have comorbidities, people with diabetes, people with hypertension, with lung disease, asthma, bronchiectasis, or heart disease, any other disease, which may complicate the course of COVID. So those patients should be preferably in an institutional setup and not in home isolation, especially diabetic patients. Okay. And the people who can safely go for home isolation are young people without any history of any other disease, who have a normal SpO2, who don't have much symptoms except little bit of fever and mild upper respiratory symptoms like cough and cold, and those patients are the only ones who actually can safely go for home isolation. The others are a little bit.
All right. Now, doctor, when one person is in self-isolation, in a home isolation, it's very difficult for them because family members will be providing them with a good diet, with a good hydrated products, but they also have to keep themselves hydrated anytime, every time, and to have a proper diet at that moment, isn't it? Now, if we talk about how to stay hydrated in those times and how to have a proper diet, so do you also provide some diet charge to COVID-19 patients to have something which can keep themselves hydrated all along?
See, with COVID-19, there is no specific diet which can help in COVID-19. What we advise is you continue whatever diet you are on, or you just have a nutritious diet and have lots of fluids. Fluids means water, juice, ORS, whatever you like. So okay, you have to keep yourself hydrated and have a nutritious diet. But there is no fixed diet as such. And another thing is that some people they have ginger and all those things. Those are not medically proven things, but ginger, it helps in the upper respiratory symptoms like cough and sore throat. It helps. So if it helps, you can use that, but it's not medically proven.
All right. All right. So one has to be hydrated also, isn't it, doctor? So, doctor, we have a caller waiting for us at this moment. We'll take the call. Hello.
Sure.
Hello.
Hello. Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
হেল্ল'
মানে হেল্ল' হেৰি কোভিড নেগেটিভ হোৱাৰ পিছত কিমান দিনলৈকে বাৰু মানে হেৰি আমি ৰেষ্ট ল'ব লাগে বা কিমান দিনৰ পিছত মই নৰ্মেল লাইফটো মানে হেৰি লিড কৰিব পাৰিম?
COVID-19 আপোনাৰ নেগেটিভ অহাৰ পিছত হেল্ল'
হেল্ল'
বুজিছোঁ পোষ্ট কোভিড এতিয়া আপোনাৰ নেগেটিভ অহাৰ পিছত জেনেৰেলি আপুনি আইচলেশ্যনত থাকিব লাগে মানে আৰু এসপ্তাহ আইচলেশ্যনত থাকিব লাগে, কাৰণ তেতিয়ালৈকে আপুনি ভাইৰাছটো বেলেগলৈ স্প্ৰেড কৰিব পাৰে। তাৰপিছত আপুনি নৰ্মেল লাইফটো মানে সেনেকৈ ষ্টাৰ্ট কৰিব পাৰে। মানে অলপমান উইকনেছ থাকিব, বেছিভাগ পেচেণ্টৰ মেজৰ সেনেকুৱা একো নহয়। চ' আপোনাৰ সেই লাহে লাহে নৰ্মেল লাইফটো ষ্টাৰ্ট কৰিব পাৰে। জাষ্ট আপোনাৰ টোটেল ফাৰ্ষ্ট ডায়েগন'চিছ হোৱাৰ পৰা বা ফাৰ্ষ্ট চিমটমছ হোৱাৰ পৰা 14 দিন হ'লেই হ'ল, 2 সপ্তাহ হ'লেই হ'ল। তাৰপিছত যদি আপোনাৰ একো অসুবিধা নাই, তেতিয়াহ'লে আপুনি ইউ কেন গ' বেক টু ইয়ৰ নৰ্মেল লাইফ।
All right. Thank you so much for calling at the moment. Doctor, we'll have more conversation on this and we are getting a good number of calls as well. But right now, we'll have to slip into a short break, viewers. We'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the Health Show with me, Puja, and we are having a fruitful discussion on the topic that is how long a person will have to stay in home isolation for COVID-19 patients, everything about home isolation, the do's and don'ts, what kind of diet one should follow. And Dr. Hrishikesh Bora is with us and guiding us in the entire episode. All right, Dr. Hrishikesh, coming back to you again. If we talk about the COVID test, so do a person will have to repeat the COVID test while at a home isolation, during that home isolation?
We get this question very frequently. The people who are in home isolation, they call us and say and ask when we should go for a COVID test again. The answer actually is no. There is no need to get a repeat COVID test after your period of home isolation is over. Suppose your period of home isolation is 14 days and you don't have any symptoms for last few days, last 3 days minimum. Then you are considered as cured and you don't need to have a COVID test to prove that. Yes, of course, you can have a COVID test done if your employer, your office needs to have a test done, but otherwise for medical purposes, there is no need to get it done.
All right. So, of course, several questions comes up at this point in time on regarding the test. So, if a person will have to get himself retested for the benefit of their parents and the well-wishers, so on which day the person should go for a test or should opt for a test, if you would suggest to them?
Yeah, in generally in the hospitalized patients or in the patients who are in the COVID care centers, what we do is we do the test on day 7. One test is done on day 7 and after 7 days of institutional isolation, we can discharge those patients if they are negative with advice for a further 1 week of home isolation. So first test can be done on day 7 for asymptomatic patients, provided they don't have any symptoms for last 3 days. No fever, no cough and all. So the patients at home isolation, if they want to do the test, it's better advised to do at the end of the home isolation period rather than in between. Because they have to be in home isolation in anyway for 14 days. So better do the test on 14 days and then move out.
All right. So then they can move out and lead a normal life there, but still with a lot of precautions, isn't it, doctor?
Yeah.
All right, doctor, if we talk about the investigation process, there are a lot of investigation process being done by the medical experts and also by the other experts during the period of home isolation. All right, we'll come back to that question. We have a caller, so let's take the call first. Hello.
Hello, I'm Shreyasi Sharma. I am in nursing school only downtown. I want to ask one question that means this time COVID is little different. After testing negative, people are dying. Formerly, before it was tested negative, people were okay, but now it is quite different. So, why this difference is coming?
Yeah. To answer your question, like I said a little while back, the problem with the complications of COVID, they generally occur in the second week. And most of the patients, they test negative after the end of the first week. Even though the pathology which is occurring in the lungs, that is continued. So the test is negative, but the complications start. So that I just talked about that the period between day 5 and day 10, which is the period when we are seeing most of the complications. In many of those patients, actually, that COVID test, if you do, it's negative. But the damage has already been done. The lungs are affected. In some patients, we get more than 50% lungs affected. So those patients have a higher risk of dying rather than in the first week, where the test is always positive. So that is one of the reasons.
All right, so this is one of the reasons. So I'm sure the question which you have asked must be benefited with the answer just a doctor gave. So doctor, we were talking about the period of test which has been repeated. You said on the 14th day it can be repeated. Now, if we talk about the well-wishers and the parents who are with the COVID-19 person. Now, if they want to do a test with them, and if they want to do a test to get reassured that they are being okay, so what can be done? And medical experts are there to call on and ask their queries, isn't it, doctor?
Yeah. Suppose the patient has tested positive, one family member has tested positive, and he is on isolation. So what do the other family members do? So what is advised is, because the patient who has been sent to home isolation, before his symptoms occurred, at least for 2 days before, since 2 days before, he was able to transmit the virus to others. So there is a risk that the other family members has already been exposed. So what we suggest is the other family members of the patients who is on isolation, they get themselves tested on around 4th day of the first case. The 4th day is because the first 2 days, then 2-3 days they have an incubation period. Or if they have any symptoms, if they have start having fever or cough before the 4th day, then they can do the test before also. So generally advice is you get the test done on 4th day.
All right. Now, doctor, if we talk about the vaccination, which is on at this point in time everywhere, and people are coming out and taking vaccines. Now, if we talk about the persons who have recovered from COVID-19, so when are they advised to take vaccine? There is a confusion about the number, the days, the months. So when is the appropriate time for them to take vaccine?
After you have recovered from COVID, the current recommendation is to wait for 3 months for your vaccination.
All right, so 3 months, not before that.
Not before that. Before, previously the recommendation was different. The present one says you have to wait 3 months.
All right. So is there a long-term like lung infection problems which is also emerging, and people are complaining about that? So for that, like what suggestions you can give to viewers and tell them that whoever has recovered from COVID-19 not to get ailment about post-COVID ailments, which is also the complaints these days are coming up. So for that, what kind of like suggestions you would like to give the viewers?
Yeah, since COVID as a whole is a new disease, we don't know about the long-term effects on the lung, because we are seeing CT scans with very much high lung involvement is there in many of the patients. So we don't know yet after 5 years whether those changes will get resolved or they will end up as some form of chronic lung disease. We are still not sure about it because COVID is a new disease. So it's been just 1.5 years of COVID. So that, but for the viewers, I would suggest if after COVID, if you're still having some of the chest symptoms, like if you're having a persistent cough or you're having too much of fatigue or shortness of breath while doing any kind of exercise, then you get yourself tested. We generally do advise for a CT and a lung function test to assess the situation.
All right. Thank you so much, Dr. Hrishikesh Bora, for joining us at this point in time and sharing those wonderful words and discussing the home isolation part, which lots of confusions were there regarding this topic. And I'm sure the viewers who have watched our show must be benefited with the answers doctor gave. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing more on COVID-related issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.